Hospice is sometimes seen as a death sentence. Now working in this field, I don't feel that way at all. Actually, I see it as almost an opening to that final chapter of life. It's not about dying necessarily. It's about living. It's about continuing to live until that final day. Whatever that looks like for that patient, for that family, what is it that makes it so worth it to them, that makes living so worth it to them? And let's fill those days with more of that.
The hospice aide walked in and very cheerfully said, "What do you want done first?" And I looked up and I said, "I want my hair washed." And boy, within half an hour, my hair was washed. She just took right over and got that shampoo out, and I was thrilled.
If they have a goal in mind, you get to have that neat opportunity to help kind of get that one last fulfillment out of life. You know, I feel like when I get to do that stuff, you know, it's not like you're just going to a job and you're going through the motions. You know, you're doing some good.
Eunice likes the socialization piece. It is difficult for her to get out and to see things and to do things. And Vicki has made a huge difference there. And our hospice staff and the nursing home staff, we're all a team in making her life the best quality that it possibly can be.
Concentrate on making sure that they're comfortable, so that can be pain, anxiety, nausea.
She never said anything about pain, you know, never. So that made me really feel good that she wasn't in any pain, you know. I don't know if I could have took it or not, you know, because I never want Margaret into any pain. If she was sick, I was sick.
We also work very closely with assisting people to complete their advance directives, making sure that their wishes are in writing so that they can be followed, and guiding them through that process. We also work very closely with community resources in this area and connecting the patients and their families to those resources to best suit their care needs and help them through this journey.
The hospice has so many resources, I believe, to help at any stage. I feel that you go into this.
As a social worker, a hospice social worker here at Crossing Rivers Health, our primary role is for the patient, the hospice patient, as well as their family members, providing emotional support, not just for that patient, but for the family as a whole. Another large piece of the work that we do in hospice is our bereavement program. And so once that patient has passed away, we can provide support to the family members or whoever the patient has identified as their family and support system for up to 13 months.
This is not just a one-person battle. It's a family. I know that they have adjustments to make in their lives when I'm not here, and somebody's going to be around to help and guide them too. And that is a huge relief.
I really pride myself on focusing on the patient and the family. Making those true relationships really gets us to individualize each care plan and each family, treating each person as though, you know, making sure that they're acknowledged and their wants are heard and followed through on, trying to get their wishes known.